Hey everyone, welcome back to Study Nurse IQ. I'm Jenny, and today we'll be diving into a super common infection you'll definitely see in clinical practice and on your exams: cellulitis. We'll break down what it is, its different types, and how we as nurses can provide the best care. And of course, I'll have some NCLEX style questions for you at the end. Let's get started. What is cellulitis? At its core, cellulitis is a bacterial infection that affects the deep layers of your skin, the dermis and subcutaneous tissues. It's most often caused by two common bacteria, group A Streptococcus and Staphylococcus aureus. To understand how cellulitis develops, let's look at its pathophysiology. The process begins when bacteria enter through breaks in the skin. These could be cuts, scrapes, a wound, or even a chronic ulcer. Once inside, they release enzymes that cause a massive inflammatory response. This is why the affected area has some very distinct characteristics. It becomes hot and red. It's swollen and tender to the touch. The borders are often diffuse, meaning they aren't clearly defined. Patients may also experience systemic symptoms like fever, chills, and a general feeling of malaise. Types of cellulitis. While cellulitis is a general term, there are a few specific types you need to know. Erysipelas. This is a more superficial form of cellulitis that mainly affects the top two layers of the skin, the epidermis and dermis. Unlike regular cellulitis, erysipelas has a very distinct appearance. The affected area is a bright red, raised lesion with a clear, sharply defined border. It often looks shiny and may have small blisters, vesicles. It's most common on the face and lower extremities and is frequently seen in infants, older adults, and those who are immunocompromised. Orbital cellulitis. This type is a serious infection that affects the tissues around the eye. It usually starts from a bacterial infection in the sinuses that spreads. Because of its location, it's considered a medical emergency as it can quickly spread and cause vision loss. Necrotizing cellulitis. This is a rare, life-threatening condition that you might know as flesh-eating bacteria. It's a true medical emergency that spreads rapidly through the soft tissue, leading to tissue death. Patients who are immunocompromised, diabetic, or have peripheral artery disease are at a very high risk. If not treated immediately, it can lead to sepsis, shock, and organ failure. Treatment and nursing interventions. Treating cellulitis is critical, as an untreated infection can progress to severe complications like gangrene or sepsis. The mainstays of treatment are systemic antibiotics. The patient will be put on antibiotics to fight the infection. Before starting antibiotics, it's crucial to obtain a culture of the affected area to identify the specific bacteria and ensure the most effective antibiotic is used. In severe cases, especially with necrotizing cellulitis, hospitalization may be required for IV antibiotics. As nurses, our interventions focus on promoting comfort and healing. Rest and immobilization. The affected area should be rested to prevent further pain and swelling. Elevation. Elevate the affected limb to help reduce swelling. Warm compresses. Applying warm, moist heat as prescribed can help enhance blood flow to the area and reduce pain, redness, and swelling. Topical treatments. We may also apply antibacterial dressings or gels to prevent further infection. Remember, early diagnosis and treatment are key to preventing serious complications. As a nursing student, knowing these signs and symptoms and how to intervene is essential for your patient's safety. NCLEX style questions. All right, time to test your knowledge. I've got 3 questions for you. Question 1. A patient presents to the emergency department with a large, red, swollen, and tender area on their lower leg. The nurse notes that the borders of the affected area are poorly defined. The patient also has a fever and chills. The nurse suspects the patient has A. Erysipelas, necrotizing cellulitis, standard cellulitis, stasis dermatitis. Correct answer C. Standard cellulitis. Rationale. The classic signs of standard cellulitis are a red, swollen, hot, and tender area with diffuse, poorly defined borders. This distinguishes it from erysipelas, which has a well-demarcated border. Necrotizing cellulitis is a much more severe condition that presents with additional signs of tissue death. Stasis dermatitis is a chronic condition related to poor circulation, not a bacterial infection. Question 2. The nurse is preparing to administer the first dose of IV antibiotics for a patient with severe cellulitis. Before hanging the medication, which nursing action is a top priority? A. Elevating the patient's affected limb. B. Applying a warm compress to the area. C. Obtaining a culture of the infected site. D. Educating the patient on the importance of medication compliance. Correct answer C. Obtaining a culture of the infected site. Rationale. Obtaining a culture before administering antibiotics is a top priority to ensure the most effective antibiotic is chosen to treat the specific bacteria causing the infection. While the other actions are important nursing interventions, they are not as critical as ensuring the correct treatment is started. Question 3. A nurse is teaching a patient with a history of diabetes about preventing cellulitis. The nurse should emphasize that the patient is at a high risk for which specific life-threatening type of cellulitis? A. Erysipelas. B. Orbital cellulitis. C. Necrotizing cellulitis. Facial cellulitis. The correct answer C. Necrotizing cellulitis. Rationale. Patients who are diabetic, immunocompromised, or have peripheral artery disease are at a significantly higher risk for developing necrotizing cellulitis, which is a rapidly spreading, life-threatening infection. I hope this video was helpful. If you have any questions, drop them in the comments below. Don't forget to like and subscribe on YouTube, and I'll see you in the next one.